Hello everyone, this is Dr. Minister again. Let us now discuss about viral hemorrhagic fever. First, we'll see the causes of it. So, families like arenaviride, first one. In that, Lassa virus, Junin virus, Machupo virus, Guanarito virus, and Sabia virus. Lassa virus, it is endemic to West Africa and it is transmitted by rodents. Arenaviride, most of the viruses are transmitted via rodents only. Okay. Next is Junin virus, it causes Argentine hemorrhagic fever. Machupo virus, Bolivian hemorrhagic fever. Guanarito, Venezuelan hemorrhagic fever. Sabia virus causes Brazilian hemorrhagic fever. Okay, so these are all transmitted by rodents. Next is Bunia virus. In that, hantavirus, okay, which includes Hantan and Seoul viruses. Okay, and it causes hemorrhagic fever with renal syndrome. Okay, and it is also transmitted by rodents. Next is Rift Valley fever virus. Okay, it is transmitted by Aedes mosquito. Okay, it affects humans and livestock in mostly Africa. Next is Crimean Congo hemorrhagic fever virus. Okay, it is caused by ticks, Ehaloma ticks. It is common in Africa, Asia, and Eastern Europe. Crimean Congo hemorrhagic fever virus. Next is Filoviridae. Filoviridae, commonly Ebola, right? Multiple species are found: Zaire, Sudan, Bundi Bugio, all these things. These are named on the cities where they were found. Transmitted via direct contact. This is main thing with infected body fluids or tissues, and these are endemic to Africa. Marburg virus, it is transmitted via fruit bats. Okay, and via direct contact with infected body fluids, and they are also endemic to Africa. Marburg virus. Next is Flaviviridae, which is common in India. Dengue virus, 4 serotypes are there: Den V1, 2, 3, and 4. It is transmitted by Aedes mosquito, right? Okay, and they are widespread in tropical and subtropical regions. Next is yellow fever virus. It is also transmitted via Aedes mosquito virus, mosquitoes, and they are prevalent in Africa and South America. Yellow fever virus. Next is OMSK hemorrhagic fever virus. They are transmitted by dermatocentor ticks, which are found in Russia. Casanova forest disease virus. It is transmitted by ticks, right, and they are found in India. Next is paramyxovirus, that is Nipah virus. Okay, they are also transmitted by fruit bats and can cause severe respiratory neurological disease, which are outbreaks are seen in Southeast Asia. So these are all the families of the virus and the virus itself which causes the viral hemorrhagic fever. Okay, so mechanism of transmission, they are different, as I said, rodent borne, like in the case of arenaviruses and some hantaviruses. Next is arthropod, that is through mosquitoes, right? For example, flavivirus, that is dengue virus, right? And Bunia viruses also, right? So Bunia virus, Rift Valley fever is there, right? So it is transmitted by mosquito and direct contact. Some of the viruses like Filoviridae family, that is Ebola, right? Ebola and Marburg virus. So Ebola causes spread through the direct contact. So different methods of transmission is there. Pathophysiology, how the viral hemorrhagic fever happens is, that is common. Okay, vascular instability, that is vascular injury. It causes the increased permeability of the vessels and decreases its integrity, right? So that's how the blood will, the plasma will go into the tissues, causing relative hypovolemia state. Next is microvascular assault, okay, which will lead to, even if their microvascular assault happens, there's more damage, then there will be hemorrhage seen. Local hemorrhage indicated by the positive tourniquet sign, which we do in dengue, right? Blood pressure will be low as the plasma volume is been lost. Cutaneous flushing can be there. Conjunctival suffocation, that is redness of conjunctiva, and organ impact. Okay, for example, like kidneys are affected, right? Liver in yellow fever and Filoviridae diseases, etc. Virus replication happens in acute phase. Okay, so prodromal symptoms can be there, like fever or myalgia, sudden onset, abrupt onset, okay, or even insidious onset, which happens in Lassa virus. So in acute phase, there will be virus replication and viremia, that is the virus will be present in the bloodstream. What are the initial symptoms of this infection? It is fever and myalgia, which is the most common earliest symptom. Prostration, that is weakness and fatigue. Pain will be there, abdominal or chest pain, and severe headaches. Gastrointestinal symptoms will be there, like anorexia, nausea, vomiting, other GI disturbances, and neurological symptoms like hyperesthesia and photophobia. Physical examination, conjunctival suffocation, as I said, redness of the eyes without discharge, but muscle and abdominal tenderness, borderline hypotension can be there. Okay, and lab findings like petechia can be there, flushing and edema, proteinuria, elevated AST, concentration. Right. Next is severe disease progression can lead to shock and multifocal bleeding and CNS involvement. So these are the severe forms of disease. There can be shock because of hypovolemia or sepsis itself, and multifocal bleeding will be there, right, because of the damage to the capillaries, right, and CNS involvement in the form of encephalopathy, seizures, and coma. So diagnosis, first we have to ask history, like travel history to the endemic areas within the incubation period. Differential diagnosis is like other treatable diseases which are mostly by other organisms like bacteria or protozoa, like falciparum malaria, shigellosis, typhoid fever, leptospirosis, relapsing fever, and rickettsial cell diseases. Even in that we see thrombocytopenia and similar picture, hemorrhagic picture, right? Lab investigation, elevated AST, hemoconcentration, and proteinuria, just now we discussed. Okay, and recognizing the causative organism. Okay, we can go with ELISA or PCR. Right. So coming to the treatment, main is supportive care. In that, fluid therapy is main. Okay, judicious fluid therapy, we have to see if there is hypovolemia or symptoms like shock or decreased blood pressure. We have to do fluid resuscitation. Cardiotonic drugs, vasopressors, if there is shock, and we have to treat the secondary infections also. Okay, and platelet replacement, clotting factors, FFPs, if there is a severe bleeding present. DIC management. Okay, then fluid loading, as I said. Specific therapy for several, like antivirals if it's available, or interferons, like that. And precautions should be taken, strict barrier nursing and infection control for most of the viral hemorrhagic fevers, except for some like dengue, it's not necessary, ortho hantavirus, rift valley fever, and a yellow fever.